Okay, perfect. I'll just start with a quick introduction. We've kind of spoke about it already, but I'm Navneet Bains. I'm a registered nurse, but I'm also a instructor at VCC with the Practical Nursing Department. And I've been teaching with them for about 6 years or so, on and off. The presentation that I'm doing is about blood sugar level. So it's quite easy to be like, what you're in nursing, of course you're going to, it's something to do with nursing blood sugar levels being high and low. It's something that you come across, which is true. And I do teach my students this, but why I wanted to do it was because when I first started, when I was actually a nursing student, one of my cousins actually came up to me and he, you're going to get into the nursing profession. So you get a lot of questions, just random questions or something about your health. So he said to me, he's like, Nav, I'm peeing a lot. And I was like, okay, like he's 20 years old and he's telling me this. I was like, okay, like, why are you telling me this? Thinking in my head, he's like, I'm also drinking a lot too. And I was like, well, that makes sense. If you're drinking a lot, you're going to pee a lot. Like, I didn't think anything of it. And that's kind of like all he told me. But I guess what had happened was he kept having these symptoms. And when he was drinking, he was actually drinking juice, not water, just drinking juice. And he kept going to the bathroom. And then because this kept happening and he started feeling worse and he started getting more symptoms, he went to the hospital and we found out that he was a type 1 diabetic, which I never thought, like in your 20s, like now, you're going to have diabetes. And then a few years later, his brother, who was older than him at about 25, presented with the same symptoms. And then he was diagnosed with diabetes as well too, which is before I thought it was like, oh, when you're a child, you get it, but they were, in their 20s and they got it. So that's what I thought it was a good idea, to do a topic like this, that I think could be beneficial for just yourself and recognizing these symptoms for other people. So I'm just going to start with a funny video that's kind of similar to my promo, and I'm just going to bring it up here for a sec. So just bear with me while I share my screen to play this YouTube video, if I can find it now. Let's see. Okay, can you all see the screen? Yes, and I'm just going to play the video. Can we hear it?
Marcia, what happened?
We can hear it?
For the football. I can't go to the death like this.
Well, I'm sure it was an accident, sweetheart.
An eye for an eye. What Dad always says. I never said that, honey.
Marcia, eat a Snickers. You get a little hostile when you're hungry. Better? Better.
Marcia.
Jan, this isn't about you.
It never ends.
Again, this is not a promotion for Snickers, but it was just a nice video that I liked. So in this situation, do you think the person who turned out to be Marcia was experiencing low blood sugar level or a high blood sugar level? I couldn't hear you, Wes. You're on silent. Or you're on mute.
Low.
He was definitely experiencing, or Marcia was experiencing, low blood sugar level. On that note, I'm just going to start a PowerPoint presentation that I will also start sharing. And let's see here. Signs and symptoms of low blood sugar level. So there's only 2 of us, but so I won't go into, or 2 of you, I should say. So I won't split us into breakout rooms, but do you know other signs or signs and symptoms of low blood sugar level? Off the top of your head.
Is sweating one?
Sweating is one, yes. Any other ones that you can think of? It's okay if you can't come up with some.
Well,
Like-
I suffer from high blood sugar, so for
Ooh.
me, I'm tired. Oh yeah, my doctor's mad at me, but whatever.
Yeah.
No, not whatever, like I'm ambivalent, but
Yeah.
so tired. My wife calls me grumpy all the time.
Yeah.
But
Well, can grumpy be one for low blood sugar level as well?
I would think so, considering, yes, I would agree with that.
Yeah, it definitely is. It can be one. You can get confusion. Sometimes your speech can be a little bit garbled if you have low blood sugar level. Have any of you ever been hangry? You've heard that term, hangry, right?
My
So
wife will not go out with me unless we've had lunch first.
yes, well, that's, it's a symptom of low blood sugar level. So you can be hungry if you have low blood sugar level, but then irritable as well too, hence the term hangry. We'll talk about some other ones here. Look at this picture. So you could be sweaty, like Trina mentioned. You can be shaky, dizzy, confusion, difficulty speaking. What you were saying, Wes, too, can be a symptom of high in blood sugar level. Some of them are really similar. Weak or tired, hungry. You could have a headache, nervous or upset. I know like this can be for somebody who's a diabetic, but really anybody. I know when I haven't eaten for a while, I can feel shaky and sweaty as well too. And it's just an indicator for my body to be like, oh, you really need to eat something right now. So what should you ask her look for if a person does have a low blood sugar level? So if they're exhibiting these symptoms, the first and foremost thing is the patient alert, because if your blood sugar level is too low, you could potentially become unconscious. So the first thing you want to see, are they alert? Do they have the symptoms that we just discussed? Are they on any medications that could potentially lower their blood sugar levels? So this is mostly for your diabetics. Like, are they on an insulin? Are they on an oral hypoglycemic? And the big one, just for anybody, is when was the last time you ate? Because that's obviously can contribute, if you haven't eaten, it can contribute to you having a low blood sugar level. And something to consider as well too is, why is it happening? Like, why could you be having a blood sugar level? And it kind of goes with the last slide. Could it be due to medications like the insulin or the oral hypoglycemic? Is there a missed meal or meals? Dieting is a huge one. People who choose maybe not the best appropriate diets could suffer from low blood sugar level. And the big one too is, are they a diabetic? So not everyone, but some patients or people do wear medical alert bracelets that could indicate that they might be a diabetic. So that's something good to kind of look out for as well too. So what should you do if somebody has a low blood sugar level? What should you do? Well, if they're alert, you should get them to eat something with sugar content. Apple juice is something really easy that you can get somebody to drink to get their blood sugar level up. There's glucose tablets that, if there's something like readily available, especially if they're diabetic, they might keep them on themselves. Give them those tablets. You can get somebody to eat candy. But make sure that once you get their blood sugar level out, they should have like a real proper meal, so they don't have the dipping of their blood sugar level again. So something to stabilize it, like protein to help slow the absorption of carbohydrates. Like I mentioned, look for a medical alert bracelet if they have it. And if they're unconscious, just call 911. It's beyond what you can do at this point, right? So signs and symptoms of high blood sugar level. Again, we're not going to go into breakout rooms, which I was originally thinking there's only 2 of us. So Wes had mentioned a couple of them. So feeling weak and tired. Are there any other symptoms that you know of high blood sugar level? It's okay if you don't. You know, this is a little bit more specialized too. What about the story that I mentioned in the beginning? What was my cousin exhibiting? Some of the symptoms. You're on mute again, Wes.
Do that on purpose.
Yes.
Well, you mentioned that he was peeing more than usual.
Yeah.
But if he was like drinking sugar, then I get it. But was he peeing a lot just from drinking water? Or maybe too much coffee, that could do it too.
That could do it too. But it was like I think at that point he was getting up like every 2 hours to pee, like throughout the night too. That's something to keep in mind too. Like getting up throughout the night. Like now he's not drinking at night and he was getting up a lot too. So it's like, so we'll talk about those. So fatigue is a big one, like Wes was mentioning for himself. Blurry vision, excessive thirst. Fruity breath. It's kind of hard to be like, does somebody have a fruity breath? But sometimes you can smell it on people if it's high enough. You have hunger as well too, increased urination, like I mentioned, and then nausea and vomiting as well too. So pretty much my cousins, they were exhibiting almost all of these symptoms, especially the nausea and vomiting, which caused them to go into the hospital. So usually this is more for like, it could be for anybody, but usually if you're going to be first diagnosed with diabetes, your blood sugar, like you kind of exhibit these symptoms and you really need to go to the hospital ultimately to kind of get your blood sugar level handled, get some hydration in you, because if you're vomiting and you're nauseous, you're kind of, you're going to drink, but then you're going to vomit up everything, right? So this is important as well too, because there's type 1 diabetes, which is what my cousins ultimately had. You kind of get it when you're younger and you're going to need to inject insulin, but there's also type 2 diabetes that you can get. And sometimes it's just genetics, but sometimes it can be based off of the diet that you have. I remember working with somebody in their 20s, like every day for like a year, I saw him drinking like a 2 liter of pop. And in his 20s, he gave himself type 2 diabetes because just his unhealthy eating habits, his blood sugar level would just keep being high. And then your body doesn't know how to handle that anymore. So diet is important, what you eat. So what should you ask or look for? So has the person's blood sugar level been high before? Is this something that's been continuously happening for them, especially with your people who have diabetes? Is the person on medications to help? Are they on insulin, oral hypoglycemics? What have they eaten? Did they eat something with too much sugar content? And has this happened to them before? Because if it happened to them before, maybe this is the beginning of something going on with them. Or if they don't have diabetes, maybe it's starting to kind of get to that point. Sometimes patients who are diabetic and they take insulin, they kind of go based off how much sugar content they have. They might inject themselves with more insulin because they're like, it's Halloween, I'm going to eat more chocolate. Let me adjust my insulin dose to accommodate that. So it's just something to think about. It's really important to know what have they been eating. Why is this happening? So did they miss some of their medications, especially if they're a diabetic? Like their insulin or their oral hypoglycemics. Stress or an inflammatory response, any infection. So just in general, if we're stressed, our blood sugar levels rise because of cortisol. So that could be kind of what's going on too. Any infection. So infection causes your blood sugar level to be high as well too. It increases it. And what did they eat? Like I said, again, it could be sugar content. Halloween just passed. It could be because of all that chocolate or candy that somebody's eating. So what should you do? So change your diet as necessary, if necessary. Maybe the person needs an increase in their medication, especially if they are a diabetic or their insulin. Has the person been sick recently? Because that could potentially let you know that what's causing their blood sugar level to be high. The person should really call their doctor. I mean, you can't be like, you should increase your insulin if you're a diabetic, they really should need to talk to a medical professional. And if necessary, you might need to call 911. It's important to know this information as well too, because I think when my cousin was newly diagnosed with diabetes, he at one point went he unconscious at some point, and his friends around him knew that he was a diabetic and they wanted to inject him with more insulin. Well, when you become unconscious is usually with your low blood sugar level, right? So imagine if they did do that and they would have hurt him even more by giving him this insulin. Thankfully, they brought him home and we were able to kind of deal with it. But it's good to know this, especially because more and more people are being diagnosed with diabetes as well too. So it's important to know the difference between the two. So in summary, the big takeaways from this are like the symptoms, signs and symptoms of low blood sugar levels. So like I mentioned before, so it's being shaky, sweaty, dizzy, confusion or difficulty speaking. You could be hungry, hangry, weak, tired. You could have a headache. You could be nervous, upset, irritable. Like in my promo video, how the person was pretty Betty White first. And then in this video, how it ended up being Marsha, just being irritable and not yourself. For high blood sugar level, it's fatigue, blurry vision, having excessive thirst, increased urination, increased hunger, fruity breath, nausea, vomiting. So all of these symptoms, just a good takeaway to know the difference between the two, especially if you're around individuals who might be suffering from these symptoms. It's just good to know, I think just in general for I don't know, just in general for anyone, actually, especially, like I said, because more and more people are being diagnosed with diabetes. Wes, do you have diabetes or just your blood sugar level is high in general?
I don't mind talking about my medical history, but
If you don't mind,
recording is stopped.
you don't have to. You don't have to at all.
Yeah.
You had
No, I
just
don't
mentioned.
mind, but not while it's recording.
Okay, sounds good. Okay. That's pretty much my presentation, I guess. Yeah. So the takeaway from here is just to know the difference between low blood sugar level, high blood sugar level. How do you deal with it? Why could it be happening for this individual? Because it could happen again in diabetics and non-diabetics, just regular individuals. So just knowing the difference. Any questions at all for me?
No, I like this stuff because I have a connection to it.
Yes.
And it was interesting. That other one that that you guys were mentioning before the recording started, the one that this one can be in lieu of, the other presentation one of the presentations was by a nurse who was talking about the science behind high blood sugar and how the body absorbs sugar. So when I saw that you were going to do this one, oh yes, I want to be on this one. So I found that I found it's just confirming a lot of what I already know.
Yes.
But it's just interesting to hear it, another perspective, which I thought was interesting.
Thank you. It's good sometimes just to reinforce that knowledge too. Yeah. Thank you, Wes. Trina, do you have any feedback for me? Oh.
Yeah, I thought it was really well done. I think it summarized everything really concisely. And like both my grandparents are diabetic, and like when they visit and stuff, we're always kind of like just making sure that they're taking care of themselves, or if they're over and they like have something too sugary, like let them know, just adjust everything for the day. So I thought it's really good as a refresher, because even when I'm with them, I like to kind of know if something were to happen, at least I can identify the signs and symptoms.
Yeah, exactly. Because sometimes we panic too.
Yeah.
Like, I don't know what's happening, like in that story that I told you, and it's like, let's just give them insulin. Well, no, that's not what you always want to do, because it could be different. Yeah, good.
Yeah, definitely the panic part.
Yeah. Well, thank you.
Yeah, no, I got some feedback.
Oh, you do? Okay,
all right,
good,
so
good.
I got feedback. Oh yeah, I got feedback.
Yes, thank you, Wes.
Okay, so I loved your intro. I love the fact that you added a personal story to it to reinforce and introduce your topic. You got a great speaking voice. It's calm and you're steady, which is nice. I tend to be up and down. I get excited, I get low, but you're just like calm, which is soothing. Let me see. Your theme was easy on the eyes, and nothing worse than black print on white. It makes your eyes go swirly, but you had that nice, off color. Maybe it was slightly green. I can't remember, but it wasn't bright white, which was very nice. I like the fact you added some animations and bullets. You animated both your slide transitions and your bullets, but you weren't crazy. Some people go crazy and you wait for the next transition, but you kept it pretty consistent, which was great. Now your teaser video that you had done with the Betty White, when you'd first put it up, I was confused because your face was in the bottom corner. And then I was looking at you. Oh, is she going to talk? She's not going to talk. Is she going to talk? No, she didn't. So completely missed the video first time around.
Whoa, okay.
Okay, and then once the commercial was finished, then you talked. He said this wasn't a plug for Snickers. I'm going, what is she talking about? So I went and watched it again. Oh, I remember these commercials.
Yes.
But seeing you in that bottom corner pulled my attention to the bottom corner.
Fair enough.
Your PowerPoint slides, I like your theme and I like your transitions, but I found it very, very wordy. So all I was doing was reading. And when now you kept the bullet short, which is sweet. In my class, when they do a presentation, they got paragraphs, and I'm going and I tell them in my feedback, I'm reading that. I'm no longer engaged to you. I'm not paying attention to you. I'm busy reading the bullets. But your first graphic with the pictures, hey, I loved it. I don't know if it's easy to put graphics behind it or not. Maybe that's not part of your workflow when you're instructing, but that's how I saw it. Let me see. Your audio was cutting in and out. So I don't know if that was your computer not being powerful enough to host. I don't know, or your available bandwidth, but your video was starting to stutter a smidge, but that could just be maybe, who knows? I'm thinking it's more of a technical issue, but just to make you aware that your voice was stuttering a tad bit. Let me see. Is that all my points that I typed down? That's why I also mute so I can type as I see.
Yeah, fair enough.
But yes, no, the great presentation, and I have, as I said at the beginning, a personal connection, which was meaningful to me, which I really enjoyed. So I appreciate you talking on this topic. I liked it.
Thank you, Wes. Yeah, that video for the screen, I didn't want to be in the end, but I didn't know how to use that Screenomaster. Like, it wouldn't let me do it without me in the corner. So I have to figure that out. So thank you for all your feedback. Actually, it's very beneficial.
Try using Zoom for your recordings and not Screencast-O-Matic. Join a Zoom session by yourself, hit record, and then you have the full Zoom controls
I actually never thought about that. That's actually
you don't have
a really
to use
good point.
Screencast-O-Matic. Yeah.
Okay, thank you, Wes. I appreciate that.
My introduction way back. Yeah, try that.
Okay, thank you.
Okay.
Okay, I think that's it. If Trina, you don't have any other feedback for me, it's okay if you don't.
I agree with Wes. Tone was really good. Like, it didn't feel like it fluctuated too much, and it was really good. Like, the visuals kind of kept you engaged. Like, you're not just a bunch of text, which I really like because I'm a visual person. But yeah, I thought it was good, and I think like the cutting in and out, I think maybe it's just the Wi-Fi too.
Okay, great. Thank you so much. I'm just gonna stop the recording now.